Hi, I am Ashley, and I have gone the last 10 plus years, almost 12, with a brain tumor. It's been a journey, that's for sure. I have gone through three brain surgeries. I've done a lot of different things along the way for just, I feel like one thing after another, but with all of that kind of going on, I've always had a positive mind through it all. So I had just graduated from Oregon State University and spent the summer here in Portland, Oregon, where I've been my whole life. And I kind of was ready to get out, try something new. So I had just moved down to Scottsdale, Arizona, and I had been there like about a month, I would say, and kind of looking for teaching jobs because my goal was to do elementary school teaching. I had a grand mal seizure on my way out one night. Like, just even thinking back, it's like crazy because it's been so long now. But I had like, I mean, other than like things throughout my life, nothing in relation, at least medically, to this. So it was very like out of nowhere, never had it before, very confused. But what happened? So what happened from there was I went straight to the hospital down there, and no one that all my family and friends were still back up in Portland, so it was kind of hard on them, which I remember thinking even in the hospital, like, oh my gosh, like my parents, I feel so bad, like they're gonna be worrying, like what's going on. That was just the beginning. But for the most part, it was a lot of MRIs, CT scans, and trying to determine what exactly they found when they did it, and trying to figure out why I had a grand mal seizure at the time. And they discovered it was a large mass in my left temporal lobe right here. And, it could have been many things. So they had decided to do a biopsy, like a little mini surgery to learn more. And so I think a couple days after getting there, that's when they did the surgery and found out that it actually was a brain tumor, a glioma, which is the type of brain tumor that starts there. It's not like starting anywhere else. It's only in my brain. And they needed to know more and do a like full-on resection and remove as much as they could. That's like the first step in any type of brain cancer. That's like the go-to kind of thing. So this is kind of like the beginning of it all at that first hospital. So I had the little biopsy surgery, and kind of just was wondering like, okay, what's next? Like, they knew at the time it was definitely a brain tumor, but that was kind of it. We still didn't know exactly what kind, and there might be other things going on. We just needed to do a better, like, or bigger, I should say, resection surgery from there. So we were sent over to St. Joseph's Hospital. It's the Barrow Neurological Institute, and it was in downtown Phoenix, and better equipped for like massive brain surgeries. And I mean, people from all over the country would go there. So I met my main surgeon there, Dr. Nakaji, and Peter Nakaji is his like full name. But yes, he was absolutely amazing. He made me feel so comfortable. We had to go through quite a few steps beforehand because I didn't know if it was going to be a awake brain surgery or I'd be asleep during it. And it's hours and hours of surgery when they do any type of brain surgery, because it's very detailed and specific, because you don't want to like mess up any other part of the brain. So we had to go through quite a few tests. I had to do a WADA test, which turned off that side of my brain and had me see what kind of like memory I'd be going through, because it was located in my temporal lobe, which is based on short-term memory, language, speech, kind of in that realm of things. So I went through all of that, had quite a few meetings, and luckily I did so well through all of that. I was able to be asleep through the full-on surgery, which I was relieved. Like, the surgery itself went absolutely amazing. It ended up being a lot quicker. I mean, it wasn't as long as they thought it was going to be because of the type it was, and it was just easier to like resect. And he was actually able to get about, I would say it was 95% of the tumor out. There was still going to be tumor cells left. I mean, any type of brain tumor, unfortunately, is like incurable. There's chances that it could be in remission for however long, but it's just very like unlikely to get all of it out, kind of thing. So yeah, so that was kind of like what I went through for the like full-on major surgery. And I did come out of it and had definitely quite a few like deficits, which I knew I'd be losing some vision in my upper right eye, that I'm like used to it. But the hardest part for me, at least, was the memory, especially after just going to college, getting my degree, ready to start my like life, my career, and get things going. Of all things, wanting to be a elementary school teacher. Specifically, I really wanted to do first grade or second grade, but I actually had to go to classes and be with that age group because of my speech and memory. I had to kind of like use different like games and puzzles and this and that to like relearn what everything was called. It's like I knew what the words were, but I couldn't put it together with what things were. I would want to get like a glass of water. I would be like, hey, can somebody get me a fork? It'd be like I just make very like, I thought they were silly. I would always joke with stuff because I didn't want to like be a downer, Debbie Downer. So I always like joke around with things, but it took a while. It took at least a year or two to kind of get back into motion of like, not kind of standing out in front of people with my wording and memory. I mean, I still do have, short-term memory loss where it kind of, I think it mostly affects me because before all this, like in college especially, I would always get called out because of how good my memory was. Like I had a photographic memory and was like, just read once, I'm good to go kind of thing. So I kind of lucked out in that realm of things. And so some of my friends joke with me. They're like, oh, now you have a normal memory. But it's not, trust me, it's not. It's definitely like a struggle. But it's something I can deal with and like have worked to like live with and, only make it better. But that's kind of how it was for, since, it happened and whatnot. But I had the surgery that 2012, or January 2012, and they determined it was a grade 2 oligodendroglioma, which is one of the major types of a brain tumor. So at the time, because it was a low grade, I had a good surgery, we decided to do a watch and wait period instead of going directly to chemo radiation, just to kind of see how it would go. So after the surgery, I didn't have to do anything. Once I was kind of like getting myself back to feeling better, we ended up, well, my parents, came home or back up to Portland, and I had to as well, because as much as I wanted to, stay there and teach and, live my life, it just wasn't gonna happen, unfortunately, just because of everything I was going through, and I needed support around me. So I moved back up here and was just, going through whatever I could to, work on my memory system and just, kind of recovering from that until it did grow back it was at the very end of 2016, early 2015. I didn't necessarily feel the regrowth happening, but I was having so many deficits in general, just from the surgery and the tumor itself to begin with, that and luckily, I do get MRIs pretty often, so they were able to see something going on at the time. At the time, I did have migraines, but it wasn't as bad as it ended up becoming. So I would say, like, in the two years or so before the regrowth happened, it was a lot of just focusing on getting better and then kind of learning to just become this new person kind of thing. I mean, there was things I would never be able to change. That's just how it was. But there's also, with memory at least, just kind of teaching myself and learning words again. And I was lucky. I look back now, I didn't have like the nausea that I do now. And there's very there's a lot of things, at least, that I am grateful for, that I like in life. It's kind of weird in the sense, like, before this all happened, I kind of looked at life in like a view of, I'm going to do this and that, and I have all these like goals and whatnot. And I feel like I now look at life differently, where little things around me mean so much, and just the simple things in life are like amazing to me now. So once they discovered that there's, at the time, they weren't exactly sure if it was regrowth or just something popping up that they were curious about. So they kind of wanted to do multiple like MRIs, like more put together than normal, for about, I would say, 2 months, because it was March when we finally decided, like, okay, it's treatment time. And that's when we had the talk with the doctor about doing chemo and radiation together this time, which is kind of like the known treatment when this kind of stuff happens, because we'd already done a massive resection and it was kind of that time. And again, it's like I already had it in my mind that this was very possible, so I didn't have the like surprised look or anything like that. I was, again, kind of like, okay, this is the plan, this is how we're going to do it. I'm going to get myself ready and I'm going to beat it. Like, I always have that, like, that's like the weird thing people kind of ask me about is like, aren't you like nervous? Aren't you like worried? And obviously I am, but at the same time, I've never had the view of like, this is going to like end me, as weird as that is. Because I mean, I've already outlived like the average life expectancy. And I don't, this is like kind of a crazy thing, but I haven't really met anybody younger than me that has like lived this long, as hard as it is. And I almost at least tell myself that positivity has such a like massive effect, because at least for me, just having that mindset and not even like thinking about death, at least, has done more than I have like asked for. So after kind of getting it all put together, it was going to start with the Temidar, which is the chemo that I luckily wouldn't have to do at the hospital. It was a like pill form that I had, and I would take that every night during the first like section of doing chemo and radiation together. So I'd be taking the chemo every day, and then I'd be doing radiation Monday through Friday for 6 weeks. And that honestly, like for the most part, it started off well. It wasn't probably till the like halfway through when I started getting like crazy tired. Did a lot of like bed rest for sure. So I started like a little blog to kind of keep everybody up to date on how I was, what things were like. And that was really fun. So once I did the 6 weeks of chemo and radiation, I had a 21-day break where I wasn't on anything. And it was right around my birthday. My birthday's in May. That was really nice. But then once I had to go back on my 6 month like round of a like way higher dose of chemo, where it was only, I want to say 5 days, the first 5 days of each month. So it wasn't like every single day. It was a higher dosage of it, but only 5 days for 6 months. But I had to stop it after the fourth month in September at the time. So it was right after I had finished doing it. I had a like very bad reaction, and they weren't exactly sure like why this happened. It's not common or anything like that, but it was really bad. I had my whole body break out in like a hives look. I like couldn't move my body. I ended up in the hospital, and they at the time just said, okay, we have to stop it. There's no way we can like continue this. And I'll admit, like I was scared, thinking like, oh no, like is it gonna work still? Like, do I need to finish it? Like, so I had that kind of like in the back of my head, just being like worried and, you know, not exactly sure what to expect. But luckily, on the good side, it slowly went away after like not having that in my system anymore. So I think what they determined is my body kind of just said, no, we're done. Like we can't take it anymore, which is, it's a bummer, but like at the same time, I had a good like overall result at the end. So once that kind of came through, it was like, it was all worth it at that point. So that was, again, it was a mix of chemo and radiation. So I'm not sure what was really giving me like the nausea, the aches, the pains. And that's also when I started getting like horrible headaches, migraines. They have a feeling it's not necessarily related to like that type of head pain, but more of like nerve pain, nerve damage that was going on, because it was only on this side where everything was like going down. And I had along with the sickness and the nausea and just all of the stuff, I lost my hair in a very unique way, because it wasn't the chemo that did anything to me, because I thought, you know, most of the time it's chemo that kind of has the hair loss, but I was lucky in that sense that the chemo that I was taking did nothing, but the radiation being on my head did. And I want to almost say it was in the like perfect spot, as weird as that sounds, because the top part stayed on and the bottom part stayed on, but in a very like precise loop around the middle of my hair was gone. This was like a huge part of my life that was not expected. So when I was going to go through chemo and radiation, I had actually at the time when I found out that there was regrowth, I was pregnant. I had just found out I was pregnant, but unfortunately I did have a miscarriage shortly after. And again, it might have been like meant to be, or just from like the stress I was going through, but that was really hard. And I think looking back, that's kind of why I didn't take the option of like saving my eggs. And I kind of just told myself back then that if it's meant to be, it's meant to be. But I just am not in a place right now to like go through that, and wanted to kind of, get the tumor done before anything. So I kind of never really even expected to be able to have kids, kind of thing. I knew I could, but it was very unlikely. Believe it or not, like a year after going through the chemo radiation, I got pregnant, and that literally like blew my mind, and was again like the happiest I've ever been, the greatest gift of my life. And my son, his name's Brody, he's definitely like what keeps me going every day, no matter what. He's what I fight for. But after that, I would do my MRIs about, I want to say back then, probably every like 3 months for about maybe the first year. And once that got kind of like cleared, like everything's good, no regrowth, everything is like kind of going down rather than up, like the cancer cells at least. So everything was looking good. So for about 6 or 7 years, like in remission, which again, I'm very like thankful, because I mean, that's a long time in the whole like realm of brain tumors. There was no changes in like my memory or deficits that had changed at this point in time. So I was, doing well for the most part, and kind of just going with the flow and enjoying what I could and just going with it. So, okay, December, so I have, my MRIs twice a year. So December 2021, on my first call, because, that was kind of during the COVID era. But so I had my doctor call me on the phone to like go over my results of the MRI. And originally he was like, "You're good." It's always kind of short and sweet. Like, "You're good. I don't see anything." And that's what happened at first. Then the next morning, he calls me again and said he wasn't exactly sure if it was like dead cells or tissue that was kind of popping up, or like what exactly it was. But he did want to kind of like view it sooner than later. So it was a very hard time, kind of just watching, waiting, kind of like, all right, like, what is this? Is it just like a scare? Is it regrowth? Like, what is going on here? Once they did that second MRI, is when they kind of said, yeah, it's definitely something. We're not exactly sure what. We need to do a surgery again. And this was not a massive surgery like before. This was another type of small like biopsy to kind of determine what's going on. Has it changed? Has anything else happened? So that's what we ended up doing about a month and a half later in April. Yes. It was in April 2022. That's when I had my third brain surgery. That one actually went pretty well. It was short because there wasn't, much going on. And so I was only at the hospital, I want to say maybe like 5 days or less even. And again, the surgery went really well. And this time was different though, because I now had a son and somebody that, I, is is my world and my number one. I mean, even with my cancer and like everything I've been going through, he will always be my number one, no matter what. But once I got the results from the surgery is when it was like the biggest relief, yet kind of like not a good thing, because obviously I don't want to hear there's regrowth. Obviously, like that's not a good thing. But on the good side of things, there hasn't been any type of a higher grade that's gotten into it, which is very rare, especially after going through radiation, chemo, and just over the years, especially in brain tumors, they normally will grow into a higher grade over time. And I always, like in the back of my mind, knew that was something to be prepared for. But to hear that it's still a low grade, like so much relief was like going off, and kind of made me like more relaxed, even though it's like not a good thing to go through at all. The one thing that like threw me for a loop was the fact that it was no longer considered a oligodendroglioma brain tumor, which that's like what I've always looked into and learned about. So when they said, nope, you don't have an oligodendroglioma anymore, you now have a grade 2 astrocytoma with an IDH1 mutation, which probably makes no sense right now, but that's what I thought too. I'm like, okay, what is this? They still thought it was an oligodendroglioma, but they did say it's kind of rare that you don't have the 1p19q co-deletions, which is more so a part of that. So now, since all of these changes they've made, because I don't have that, I now am considered a astrocytoma. And the two main mutations that I have basically like caused a brain tumor is the TP53, which is a gene or like a mutation that does a lot of, or it causes a lot of cancers, not just brain tumors, many others as well. Aside from like having the news, like, yes, you have, your tumor is back, it is still at a good level to deal with, where normally in the past, at this point, I would probably have to go through my second round of radiation. And the weird thing with my chemo in the past is they still aren't sure if I should ever try that type of chemo again, just because of how it affected me. But now, with all of these other like changes, they've found a new type of chemo that's actually used with a certain type of leukemia. Since mine is at that level and still very slow with the growth, they decided, like, you know what, we should try this, because this might be something that is positive and can help you. There's been a couple other people with my main oncologist, one of my main doctors, that's had really good results with a few of his other patients. And I was like, yep, I want to try. I will try anything and everything. And even like outside of the like medical realm of things, I, try to eat healthy and exercise, especially with coaching cheer and being a mom. So doing all of that. I love yoga. That's like my go-to. And just, making sure things like are around me 24/7 are helping as well. So it's going to be almost a year of going through all this is when I started the Tipsobo that I take at night, every night, 250 milligram pills at night. And it's been Overall, I would say other than the nausea was hard at first. I had to have like my body get used to it. And so I would say after probably like 4 months or so, I finally got to stop taking nausea medicine. And I still get the nausea here and there, but I've kind of like just learned to live with it. And other than that, just the head pain and the tiredness. That's the other thing that hasn't gone away is I do get really like fatigue, and it's kind of hard to kind of put myself through things that were just so easy before. I will say it's definitely stressful because it's kind of like another watch and wait period of time because it's not anything like right here, right now. So I do have my MRIs every other month, and then I have my blood work done every month and my EKGs. Like I just kind of have to like keep up and get all of that taken care of to just make sure things are going well. And so far, so good. Usually by now, it should have stopped the growth from what I've heard. And it hasn't quite done that yet. It's definitely like slowed the growth down for me, but it hasn't like completely stopped it. So I'm like praying my next MRI will, have a good outlook on that. But there's always a chance that if it doesn't, I might have to like start something else. But I'm not gonna like worry about that just yet, and keep going. Living with this for so long, especially this type of cancer, and having so many, good times with bad times as well. But I feel like having that positive mindset has done so much. Helping others is a huge thing for me, for sure. Even if stuff like this does happen, instead of kind of like putting myself down, I try to think of the positives. And like, I'm not saying it's easy. I'm not saying I enjoy having to do all this, but it definitely has given me like the strength and just the fight again